Hi, my name is Amna Osman, CEO at Nashville CARES. Our mission is to end the HIV epidemic in Middle Tennessee through services, advocacy, and prevention. These Fireside Chats are conversations for you. They're conversations that we want you to hear so you can focus on yourself and you can really take care of you. It is a conversation and a chat for you. So Dr. Rager,
yes,
how are you doing?
I'm amazing. How are you?
I want to ask you, how did you get started in this journey around really making sure that people are not only mentally healthy, which you did for CARES, but your whole journey around sexual health and making sure that each and every person you saw was living their best life, were thriving in all aspects, and most importantly, in sexual health?
My passion has always been for helping people make healthy decisions around every aspect of their life, right? But particularly around sexual health, because I just have been able to cultivate this comfortable way of talking with folks about all aspects of their health.
Why does it come easy to you?
I think it's something that I've actually tried over the years to teach trainees how to do a great sexual health interview, how to help people feel comfortable, how to treat this like any other aspect of health, right? People find me comfortable to have difficult conversations with.
I mean, Rager, you are comfortable.
Sometimes when I'm like at a party and somebody comes up and starts talking to me
I could talk to you about anything. You are a person that I can say anything to you. And I think that is really, I think, a great recipe for somebody being able to open up, because, sex is one of our basic needs, but we don't talk about it comfortably.
It is a basic need. Yes. And I think we really work hard at Nashville CARES Clinic to cultivate all those aspects for folks.
In 2020,
yes,
during the pandemic, Nashville CARES opened up a clinic. And the reason why we opened it is because we were concerned that people didn't have access to healthcare, to culturally competent providers, to caring providers that loved them, that saw the whole person, and really wanted to make sure that during a pandemic, we still were able to have people access healthcare.
Yes. Specifically, what pulled me to CARES, I'm going to tell like a little bit about my own adolescence. Like the first boyfriend that I ever had, I told you this.
Right.
It's a little bit embarrassing, but the first boy that I ever kissed, shortly after that, we all found out that he was living with HIV, and that was in the late 80s. And it was such an unknown, and it was really scary. And he ultimately passed, which was the saddest thing for all of us.
Yeah. For you to have that journey, and for you to, with your first boyfriend that you loved, that you cared for, to be able to learn about HIV that way, I think that's not how people should learn about HIV.
Ooh, no.
We should be educating folks and young folks about HIV and sexual health before they have to encounter what you encountered.
Sure,
right?
Sure. You could get your health where you can get your health care
anywhere.
You can choose to go anywhere.
Yeah.
But folks choose to come back to us because they feel such a connection with us and know that we genuinely care about them and their lives as a whole person. And
isn't it amazing? We care. Nashville CARES. We care.
I did not pick the name.
I know.
The name was picked way before we came on the scene.
I know, but it truly is a name that speaks to everybody at CARES, our team, and how they truly care about people. And I think most importantly, they love the people that they serve, and they truly want the best for them.
Sure.
So let's shift gears, Dr. Rager, and let's talk about PrEP and why we don't have the uptake that we would like to see to prevent HIV.
Oh, my word.
Yeah.
So to be able to have this medication that is more than 99% effective in preventing the transmission of HIV, and to have folks not utilizing it is confusing and frustrating. And so I think it in part goes to what you're saying, back to the beginning of our convo. Sexual health is not something that many folks feel comfortable talking about in the first place.
Right.
I have friends who are physicians who either don't know about it or don't know how to prescribe it or don't know how to have a conversation around sex to even bring it up.
So it's a provider issue.
Barrier.
Okay.
Provider barrier for sure. When was the last time someone unprompted by you inquired about your sexual health in a visit? And I think that our patients keep on seeing us because they know that we view them as that whole person.
That's amazing. That's amazing.
It's great.
It's great.
So I love the mobile unit. I'm really excited to see what sort of services we continue to provide through that, whether it's bringing PrEP to communities who don't have access, whether it's providing HIV care to people who live out in the state for whom it's difficult to get to us. I love the idea that we're going to expand and be able to provide other layers of sexual health care and again, reach people who would otherwise do without, or who might, as you were hesitant to access the care that was close to you because you were afraid on some level what that might look like. Maybe folks have care that's close to them, but they're afraid to access it because they're in a small community and, people talk about stuff. I think that can be a real barrier, especially if you are bringing up something like PrEP or HIV testing that you're worried about for yourself, but you're afraid to tell people why. You're afraid to tell your provider why you might be worried.
Well, Dr. Rager, as our medical director, an amazing provider that cares about the whole person, that wants people to have a comprehensive sexual health, mental health, and physical health experience when they come to the Nashville CARES Clinic. What are parting words that you want to share with folks? And what should they think about as we move forward into the exciting comprehensive hub next year?
I would just like for anyone who is contemplative of their health care, not even to the level of worry, but they're just thinking about it and wanting to make sure that they are well in all ways, that we can offer you a place to address that. Again, that's going to care for you as a whole person, who's going to celebrate you as a whole person, who are knowledgeable and well educated on the topics that are at hand. And say, please come see us. We would love to take care of you.
Awesome. Well, thank you, Dr. Rager. It's exciting. Thank you for all your contributions, for each and every person that you have supported and helped and seen and loved and cared for. And I have a really great feeling that next year is going to be amazing, and we're going to support and help even more people. Be healthy, get to know your status, come and get tested at Nashville CARES, and come and see Dr. Rager if you need her.
Please come see. Yes.
Thank you.
Thank you. Thank you so much.